discussion of the doctors. Today we have a very important but exciting topic, which is known as chronic venous disease. Also later on in the show, we're going to bring out one of our guests who's going to talk about living with some of the disease states and the symptoms. Now, the purpose of our topic today is to talk about some of the disease, the symptoms, as well as some of the treatments. But before I go any further, let me introduce our doctors as well as our pharmacists. So today we're discussing cardiovascular disease, but I want to introduce our panel before we go any further. Now, to my right, I have a lead cardiologist from Northwestern. Would you like to introduce yourself?
Yeah, I'm Dr. Kevin Toms, and I want to say thank you for having me on today's show.
Well, we're excited to have you today. Now, to my left, I have a lead pharmacist from the University of Houston. Would you like to introduce yourself?
Good evening, everybody. My name is Dr. Wabia, and I am the lead pharmacist.
So now we're talking about chronic venous disease. Now, under normal conditions, the vein returns blood back to the heart, but during chronic venous disease, blood gets blocked due to valve damage, blood clotting, or blood retention in the lower extremities. So to my right, I have Dr. Toms, which is the leading cardiologist at Northwestern Hospital. Now, what Dr. Toms is going to talk about some of the common signs to look out for chronic venous disease. Dr. Toms?
Thank you. Okay, the thing about chronic venous disease, it is some really easy to spot signs. The most common one being is redness or swelling in the legs, especially after you've been standing for long periods of time. Here's a picture of a typical example of chronic venous disease symptoms. There's the swelling and redness in the legs. Some of the other signs to look out for are flaking or itchiness around your legs and ankles, or persistent swelling and tiredness in your legs. Now, I know a lot of viewers at home don't like to go to the doctors, they don't like needles, they don't like having all this tests run on them. But if you think you have chronic venous disease, you should go see your doctor because they don't do any of those things to diagnose you. So the doctor will run a very simple vascular ultrasound to take a look at inside your veins to see if there's any obstructions.
So we just had Dr. Toms talk about some of the common signs when dealing with chronic venous disease. Now to my right, I have Dr. Wabia, who is a pharmacist in the cardiovascular department, who's going to talk about some of the treatments for cardiovascular disease. Dr. Wabia?
Thank you. Yes, we will be talking about chronic venous disease. Some of the treatments you can regulate on your own time, or when it becomes very detrimental, you have to go in and see the doctor. I know it sucks, but got to keep our health up. So the first one that you can do on your own time is elevating your foot. This it helps the circulation to go from your legs and to back to your heart to get oxygenated. Another one would be to wear compression socks. As we can see in this picture right here, this is how the compression socks works. So it's more pressure at the bottom of your foot, and it decreases pressure so that your veins could be increased pressure as they go up. So it pushes the blood back up to your heart. So when the disease becomes more detrimental to your health, more extensive treatments are needed, such as diuretics. Diuretics are used to reduce the swelling in your legs. You have to go into the doctor for this. I'm sorry, no, we don't like to go see the doctor, but this reduces swelling. Later on the show, we'll be discussing other extensive treatments that will also help with this disease.
All right, so I'd like to thank Dr. Toms and Dr. Wabia for joining us today. Now, up next, like I discussed earlier, we're going to have a patient who's actually living with chronic venous disease. We're going to take an inside look when we come back.
Hello, Mr. Thames. My name is Dr. Rowe from Specializing in Internal Vascular Medicine. How are you doing today?
I'm not doing so good. I'm having problems with my leg.
Well, Mr. Thames, we will try and take care of that for you today so you feel better. Now, you were referred to me by your primary care physician, and he identified a vascular problem in your leg. Can you tell me the symptoms that you're experiencing?
Yes, I'm starting to have tiredness and soreness and heaviness in my leg. I started to see that the symptoms started getting worse. When I took a 30-minute walk each day, it started to feel a little better. But now that I'm starting to see that, I'm starting to get swelling and dark spots over my leg.
Dark spots over your leg. Okay. I see. Well, let me take a look at your leg. Is that all right with you?
Yes.
Okay. Does that hurt?
Oh,
All right. So you said you do have a little bit of pain?
yeah, I'm starting to have a constant burning sensation.
Okay. I do see the hyperpigmentation and some ulceration on your leg, which are the dark spots on your legs, and there's some scab formation. The swelling is most likely caused by the blood pooling in your leg due to the venous obstruction. I've already received the results from your primary care physician, and the tests do confirm that you have a condition that is known as CVD. It's also known as chronic venous disease, or sometimes also referred to as chronic venous insufficiency.
So can you clarify that for me? I mean, what's gonna happen to me now?
Okay, well, first things first, I just want you to know that this condition is rarely ever life-threatening. There are medicinal therapies that are available that will help you manage the symptoms, but the problem will not completely go away. The medication that we're going to start you on is known as Lasix. There is a generic available, so it's not going to be too expensive for you. And this will help with the swelling. All right. The key player in the management of your disease is going to be something called compression stockings. Okay. These you can purchase at most medical supply stores and even some pharmacies. The specific one that you want is known as the gradient compression stocking. What it is, it's got a higher pressure on your ankle area, and it gradually decreases as it goes up, which will help manage some of that flow going back to your heart. So it will help alleviate some of the symptoms. However, the problem will not completely be cured.
Okay, so is there anything I can do to help manage the condition?
Yeah, regular exercise is important, especially in the early stages of CVD, like in your case. Bicycling, running, swimming are excellent in getting the blood moving through your veins, which can help reduce swelling in your leg.
Okay, so if the condition worsens, what are my options then?
Okay, well, it will depend on how the situation persists. There are 3 different types of surgeries and treatments that are available that we could opt for. One's known as ligation, which is when the physician ties off the vein, causing a seize of the blood flow. We can also do venous repair. We can basically try and fix the problem that is causing this issue, or we can completely try and replace the vein, known as a vein transplant. So what we'll do for right now is we'll start you off with the medication, and which will again alleviate the swelling and help reduce the blood flow. So I'll have the nurse bring the prescriptions to you. I want you to start on them as soon as you can possibly start, and then I'll follow up with you in a couple of weeks. All right, Paul?
All right.
All right. Thank you.
Thanks a lot.
Mm-hmm.
All right, and welcome back to this week's episode of The Doctors, which the topic today is chronic venous disease. Now I'm going to move to our audience and we're going to ask a couple of questions. Who has a question? Yes.
I have a question for Dr. Toms. Can you please explain if the surgery is effective?
All right, that was such a good question. Dr.
Yeah,
Thomas,
very,
would you like to
very
answer
good
that?
question, yes.
Okay.
Okay, now there are multiple surgeries that can be done depending on what's causing the problems,
Okay.
but all of them are very safe and very effective. Now, I should mention that the bypass surgery, which is really only done for some of the more severe cases, it's still very safe, but there is a small risk of getting an infection where they make the incision
Okay.
or blood clots forming from that. But other than that, they're all very safe, very effective surgeries. If you have to have the surgery, I would not be worried at all.
Thank you. Thank you. Does anybody else have a question
I
here?
have a question.
All right. What's your question?
My question is, I have a family member that passed with
Okay.
chronic venous disease. Am I at high risk for this disease? That's all.
That was such a good question. Now today we have Dr. Ralph in the building, Rob, thank you for joining us.
Thank you for having me here on
Now,
the show.
would you like to answer that question that this young lady just asked you?
Yes, actually, the genetic factor actually plays a major role when diagnosing this condition. Much like many other diseases that we struggle with in today's times, there's actually a 90% chance if both of the parents have this condition that you'll get this condition. But if only one of the parents have the condition, there's less than a 20% chance that you're going to have to struggle with this condition. Even though the genes do predispose a person to this condition, lifestyle actually plays a major role. Things like smoking, lack of exercise, and sedentary lifestyles can cause can increase the risk that a person will develop this condition.
Thank you so much for answering that question.
Not
And
a
thank you
problem.
so much for being on the show today.
Not a problem. Thank you.
Well, that about wraps up our show today. I'd like to thank everyone for joining us, our audience. Dr. Wabia, thank you for
having
joining
me.
us.
Thank you.
Dr. Roth, thank you for joining us. Dr. Tom, thank you for joining us. And Paul, thank you for being on our show today. Really appreciate it. It took a lot of courage for it to come out and talk about your disease state, but we really appreciate it.
Thanks a lot.
All right, give yourself a round of applause. Well, tune in next week as we've been discussing a new topic, a topic that has changed people's lives all around the world. We're talking about childhood obesity. Tune in next week. Thank you.